All right, the cost of insurance is rising because of Obamacare. But what if there was a way to negotiate prices with your doctor the same way you would a salesman, the same way you maybe buy a car? It turns out there is, and I have an example. Our next guest helped a patient save a whopping $17,000 by not going through his insurance. You curious? I thought so. Joining us right now is Dr. Jeffrey Singer. How is that a win-win for everybody, Dr. Singer?
Well, what a lot of people don't realize is that many doctors, in fact, more and more doctors and hospitals, are willing to negotiate substantial discounts to people who don't have insurance who are willing to pay cash up front. So in this particular patient's case, he had a very, unfortunately nowadays, rare type of insurance where he didn't have any preferred provider agreement or anything like that. It just paid it was like an indemnity catastrophic policy. It just paid a fixed amount. And the price he was quoted from the hospital was outrageous. So we just said, let's just start all over again and cancel the scheduled surgery and pretend that you don't have insurance and just start negotiating prices. And by doing that, and we were certainly not prevented from doing that by any contracts, we were able to save him $17,000. He was able to negotiate a cash discount from me, from the anesthesiologist, and from the hospital where he had his surgery.
See, I understand why he'd be happy with that, but why are the doctors and the hospitals happy with that?
Well, because we don't have to go through the expense of having to get paid. Normally, like for example, in my case, for me to have the cash up front, I don't have to pay 3 people to fill out all these forms and deal with the insurance company to wait 6 weeks to get paid, and get paid pretty much the same amount anyway, despite what I asked for. So it tends to be in my best interest to do this for cash, and a lot of hospitals feel the same way. People are not aware of that, and if more and more people actually negotiated cash discounts, you'd actually see what the real market price for things is. Because right now, if you try to ask your doctor or your hospital, what does this cost, they can't give you an answer.
I know. It's the only thing, I think, in our country where you just have no idea how much anything costs. Here's some examples that you gave to us for the average person to go in a different situation or something similar. Get high deductible insurance if you want to cut a deal. Pay for procedures out of pocket. Find out what they are. See if you can talk the doctor to a lower price. Shop like a consumer, which you just mentioned, and cut out the middlemen, which in many cases is insurance. Let me ask you, are you one of the rare forward-thinking doctors that thinks like this? Could some doctors say to yourself, look at you like you have 3 heads when you bring this up?
No, more and more doctors are doing this. In fact, like I say, even hospitals will do this. The problem is it's not getting out there. People aren't aware of this. In fact, in Oklahoma City, there's a center called the Surgery Center of Oklahoma City. It was started by doctors. They don't deal with insurance companies at all. They don't deal with Medicare or Medicaid. They have a very transparent, complete price schedule listed on their website that includes everything from the surgery to the nursing care to the pre- and post-op care. And they're competing with the hospitals throughout Oklahoma City so effectively that the hospitals are starting to hurt because they're losing customers.
Well, Dr. Singer, have a great weekend. Thanks so much for sharing your story, and hopefully we put a light bulb under some people's heads who are putting off surgery because they don't think they can afford surgery.